So I'm Rayaz Malik, Professor of Medicine at Weill Cornell, and I want to provide this brief video of how to essentially examine very quickly for peripheral neuropathy in patients with diabetes. Why is that important? Because we know that a minimum of 50% of patients will have neuropathy, and if these patients have neuropathy, then they are at risk of foot ulceration and amputation. And I think in any society where we have a high prevalence of diabetes, the minimum we should be doing is looking for early signs of neuropathy to prevent the long-term complications. So the assessment of diabetic neuropathy is clearly important, and traditionally we would use instruments like this, which would allow you to assess the reflexes, or this, which is a tuning fork, which allows you to assess vibration. But one of the problems with this approach is that this is very much person or physician dependent, and therefore there's a lot of variability, and we actually can't really establish a grade of neuropathy. All we know is whether it's normal or abnormal. So we're going to replace this with an instrument called the Neurothesiometer or Biothesiometer, which allows you to quantify vibration perception, which is a measure of large fiber function, in a quantifiable manner from 0 to 50. 0 to 15 being normal, 15 to 25 mild to moderate, 25 to 35 moderate, and more than 35 volts being severe neuropathy. So this is the instrument, the Neurothesiometer. You essentially have the probe, which vibrates at a given frequency, and this, you can see as I turn it up, goes from 0 to 50. So, and this is how easy it is. So, patient, hello George, how are you?
Great.
So, today I'm going to examine your feet to establish whether or not you have damage to your nerves from diabetes,
Right.
if you had diabetes.
Yeah.
And first of all though, I want to establish whether or not you know what I'm talking about when I'm placing this instrument. So just give me your hand, just show me your finger. So if I place this on your finger, you should just feel the instrument touching you, okay?
Yeah.
But now you'll feel a buzzing sensation.
Yeah.
You feel that? So what I want you to do is wait until I touch the instrument on your toe, but as soon as you feel the buzzing sensation, yeah,
Yeah.
you let me know.
Sure.
Okay, so we're going to do that now. I'm just going to place it on the end of your toe, and I want you to close your eyes, okay?
All right.
And you tell me when you first feel the buzzing sensation,
I can feel it now.
okay? And again,
Now.
okay, and again.
Now.
Okay, so that's 3 times we've assessed that, and we get an average of the vibration. Now, of course, this is normal, and this was 6 volts. But in people who have diabetes and diabetic neuropathy, their voltage will be much higher, and we can put them at different risks of diabetic neuropathy and foot ulceration.